I'm here with John Hubbard, Global President, Icon Clinical Research, and he said in our panel discussion this morning, leveraging relationship structures to optimize sponsor CRO collaborations. John, tell us a little bit about the panel discussion and your thoughts and impressions of that, and the insights that came out of it.
Well, I thought it was an excellent panel. All the participants knew each other, have known each other for a number of years. I think one of the benefits to panel discussions like this is all the individuals who are on the panel are actively involved right now in some of the process changes that we were discussing. We've all talked, those of us who have been in pharma and CRO industries over the past, 25, 30 years, have been watching the industry evolve. And it's been a slow process. And sometimes it takes environmental factors to drive change. And I think one of the things with a lot of the challenges we're facing now with the financial community and the environment, it's stimulating change at a much faster rate. It's clear that organizations want to move away from a traditional transactional approach to outsourcing. I think everyone realizes that it doesn't yield a lot of value from just a pure logical point of view. If you're going out in a situation where every experience is a new experience, you're not going to take advantage of learnings, you're not going to take advantage of process and doing things in a consistent way. So, moving more towards partnership, moving more towards strategic relationships in the long term provides value, and I think a lot of the presentations that have been done this week, both with sponsors and CROs, support that transition. Now, it's very difficult. It requires a lot of commitment from both the pharmaceutical or biotech sponsor as well as the CRO. It's not something that happens in a year or even 2 years. Sometimes it takes much longer. But if you have a well thought out plan, you have the right people in the right positions, commitments from both organizations to work through challenges. I think the data for the relationships that have been in place now for several years support the fact that there's more value, there's better quality, faster development. I think the tough surveys support that. So I think what we're going to start to see over the next several years is more organizations, more large pharmas, large biotechs, mid-sized pharmas moving towards a reduced number of suppliers, more strategic relationships, and really trying to leverage experience. And I also think the move towards globalization is going to drive that. One of the things that we talked about in the session this morning was that 50% of the trials that are being done now are being done globally. And we see that as a continuing process that's going to require companies to work with CROs who have true global footprints, who've been in these various countries for a number of years, who have a good understanding of standards of care, who have good relationships with investigators, and also good relationships with regulatory authorities to get basically the products or the drug studies approved and to get product into the country to do the trials. So I'm very encouraged. I think that this is going to be a step change in the industry. I think it's going to accelerate what was already happening, and I think it'll be ultimately good for pharma sponsors, whether they be small or large, and also CROs.
Excellent. Thank you very much.